Implantable port access and flush. Introduce yourself to the patient, explain the procedure, gain consent, and check allergy status. Decontaminate hands according to the WHO 7-step technique. Don plastic apron and non-sterile gloves. Decontaminate clinical trolley with alcohol wipes. Remove apron and gloves. Decontaminate hands and apply apron. Gather all required equipment and place on lower shelf of trolley or suitable table if in community setting. Equipment required for a single port: a 10 ml syringe, one 10 ml PICC, one needleless connector, one ChloraPrep applicator, one port access needle, a 2% chlorhexidine with 70% alcohol wipe for skin, one sterile dressing pack with one pair of sterile gloves, and one pair of non-sterile gloves. Open sterile dressing pack and place all equipment onto the sterile field adhering to ANTT. Decontaminate hands and apply non-sterile gloves. Palpate for the port, feeling for north and south, east and west. If required, a sterile skin wipe can be placed as shown to ease identification of the port when returning with the port access needle. Remove gloves and decontaminate hands. Apply sterile gloves. Apply needleless connector to port access needle infusion line. Prime line using PICC. Then reclamp the line. Prepare ChloraPrep applicator by holding downwards and pinching wings between your thumb and forefinger. Ensure solution enters foam applicator pad. Clean intended site and surrounding area for 30 seconds in a forward and backwards manner, working outwards from the entry site in a rectangular fashion. Allow to dry for 30 seconds. Prepare port access needle for insertion by removing cover. Feel for the opposing edges of the port, taking care not to contaminate the key site, so ensuring ANTT. Advance the port access needle through the skin and into the port, ensuring you feel the needle contacting the back plate. Attach 10 ml syringe, unclamp the line, and withdraw 4 ml of blood. Clamp the line and discard the blood which was withdrawn. Attach PICC, unclamp line, and using a push-pause technique, flush port with 10 ml of sodium chloride PICC. Finish with applying positive pressure by pushing tightly on the end of the syringe with some pressure for the final 1 ml. Apply clamp and lock off. Ensure line labeling in accordance with the regional line labeling policy.